Before you start taking Ivabradine, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with food as directed by your doctor, usually twice daily. The dosage is based on your medical condition and response to treatment, and in children, it is also based on their weight. Your doctor may direct you to start at a low dose and gradually increase to reduce the risk of side effects. Other medications are usually used along with Ivabradine to treat heart failure, so make sure to follow your doctor's directions for taking all your medications. If you are using the liquid form of this medication, carefully measure the dose using a special measuring device/spoon and follow the instructions for use from the manufacturer. Take this medication regularly at the same times each day to get the most benefit from it. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it is safe to do so, as grapefruit can increase the chance of side effects with this medicine. Remember to tell your doctor if your condition does not improve or if it worsens. If you experience dizziness or tiredness while taking Ivabradine, it's important to inform your doctor or pharmacist. This medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Ivabradine may rarely cause vision changes such as brief increased brightness, or seeing halos or colored bright lights. If you experience vision changes, they usually start within the first 2 months and may go away during treatment or after stopping this medication. It's important to tell your doctor right away if you experience any serious side effects, including slow/fast/irregular heartbeat, fainting, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. As always, it's important to consult your doctor before starting or stopping any medication. Before taking Ivabradine, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to discuss your medical history with your doctor or pharmacist, especially if you have a history of low blood pressure, liver problems, or other heart issues. Ivabradine may cause dizziness or changes in vision. Avoid alcohol or marijuana, as they can increase these effects. It's important to be cautious when driving or using machinery, especially at night when sudden changes in light brightness can occur. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about using reliable forms of birth control while taking Ivabradine. This medication may harm an unborn baby. It's uncertain whether this medication passes into breast milk, so it's not recommended to breastfeed while using Ivabradine. Be sure to consult your doctor before breastfeeding. When taking Ivabradine tablets, it's important to be aware of potential drug interactions that can affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, there are several other medications that can affect the removal of Ivabradine from your body, which may in turn affect how Ivabradine works. These include azole antifungals, such as itraconazole, ketoconazole, macrolide antibiotics, such as clarithromycin, telithromycin, diltiazem, HIV protease inhibitors, such as nalfinavir, nifazodone, rifamycins, such as rifabutin, rifampin, ritonavir, St. John's wort, verapamil, and drugs used to treat seizures, such as carbamazepine, phenobarbital, phenytoin, among others. It's important to discuss any potential interactions with your doctor to ensure the safe and effective use of Ivabradine tablets. Remember to take the medication as prescribed by your doctor and follow their recommendations for the best timing and dosage. If someone takes too much Ivabradine and experiences severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include a very slow heartbeat. When it comes to taking Ivabradine tablets, it's important to follow the dosage instructions provided by your doctor. Typically, the recommended dosage is taken twice daily with meals. It's crucial to take the medication at the same time every day for optimal effectiveness in controlling your heart rate. Be sure to talk to your doctor about the best timing for taking this medication based on your individual needs. The benefits of Ivabradine tablets include helping to lower heart rate and reduce the risk of certain heart-related problems. Be sure to discuss any concerns or questions about this medication with your healthcare provider for personalized guidance. It's important not to share your Ivabradine tablets with others. While taking this medication, you may need to have lab and/or medical tests done, such as checking your pulse and blood pressure. Make sure to keep all of your medical and lab appointments, and consult your doctor for more details. If you forget to take a dose, just wait until your next scheduled dose. Don't take extra to make up for the missed one. When it comes to storing Ivabradine tablet, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place where children and pets can't reach it. And when you no longer need the medication, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember not to flush it down the toilet or pour it into a drain unless you're instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.